This is why we're here tonight. Before we go any further with what Hannah has been doing and what are Hannah's future plans, we have a special guest here tonight and who's ready to give us some good information. And we're going to call upon our immediate past president that will introduce our speaker for this general meeting. And as Madam IPPs come in, we do see another past president, Dr. Flo Gerner.
Thank you, Madam President. Good evening, everybody. Okay, so I have the pleasure of introducing our speaker for this evening. I was looking at his bio and his CV, and I'm like, oh my God, it would take the whole meeting just to introduce this man for all that he has accomplished. And as a Haitian myself, I read the bio with so much pride. And we all know him. He's a pillar in our community, Dr. Angelo Gousse. Who's right there. So I'm just going to give you just a snippet of who he is, and his bio is a public, right? It is public knowledge, so you can always find it and read it. But just to say, he is only one of few fellowship trained, I may add, urologists. So to be exact, is reconstructive and neurourology in South Florida. There's not a lot of them if you do the research yourself. Of course, his fellowship include Director of Female Pelvic Medicine and Reconstructive Urology Surgery. So the ladies, that's me. And he works at, of course, Memorial Hospital in Miramar, Miramar. He is a former tenure professor at University of Miami Urology, Miller School of Medicine, and Department of Urology, vice chairman of University of Miami Hospital and Clinic Urology Services, where he was also the urology residency program director. So you probably met some of the doctors that we all know and work with as a fellowship. Of course, he is director also of urodynamic laboratories at the VA Medical Center, where he also supervised the neurourology care of spinal cord injury injured patient. And he is a graduate, and may I add, valedictorian. Amen. Graduate of City College of New York City. We all know City College or York College, I think they used to call it. And of course, and it goes on and on. So I'm just gonna, like I said, just highlight a few. He was the first to offer the sacral uromodulation as an intern and an introductory injection for Botox for urology problems. So nurses, you kind of know what Botox, not the Botox, the people shoot up in their face so their face can look like this. Not that Botox, but Botox for treatment. So not to keep you guys waiting for too long, I'm going to please put your hands together for our very own, we claim you, yes, Dr. Angelo Gousse for his